Hi, my name is Dr. Natalie Smith. I am a medical graduate from St. James School of Medicine, and I've completed my rotations in Chicago and here in Toronto, and I've had the opportunity to work as a physician's assistant. So I am happy to meet with you today as a medical graduate and a residency candidate to further discuss the importance of medicine and the Black community.
Yeah, for sure. Thank you so much, Dr. Natalie. It is really great to have you and be our guest speaker today. Our Black Healthcare podcast aims to discuss health issues as well as social issues that impact Black Canadians and Black people across the world. So let's get started. Tell me more about yourself, your medical specialty, first, and then why is it important for people to see their family doctors, often particularly Black people living in Canada?
Okay, wonderful. I'll get started. So I'm a first generation Canadian, born to Jamaican parents or parents of Jamaican descent. I was born and raised here in Toronto, Ontario, and as I mentioned before, I completed my degree, my medical degree in St. James School of Medicine, which is in the Caribbean. So that was nice. And then I got the opportunity to finish my trainings in Chicago, Illinois, and here in Toronto. I have not yet completed a residency training program, but my aim is to do family medicine. That is where I am gravitating towards. That's where I've had my experience in. And so that is definitely the aim. I would love to speak to the question that you've asked, and I do feel it is very important for Black people living in Canada to see their doctor, especially when the government is funding a portion of our basic health care through OHIP, which is the Ontario Health Insurance Plan. It is extremely important for members of the Black community to see their family doctor regularly. And I would say that regular checkups would be once every 6 months to do physical work and blood work, just to make sure we can address any early signs of any condition that might be missed or any illnesses. So that would be my recommendation.
Thank you so much. You already answered my second question, which is how often should one make an appointment to see a family doctor?
How often? Yes. I would say every 6 months, if possible.
Mm-hmm.
Yes.
Moving on to the next question, because that's really, really important. Are there any health-related illnesses that Black people in Canada are more susceptible to, and what factors cause this?
Okay, good question. So, yes, the short answer to your question is yes. There are a few illnesses that affect the Black community predominantly. Black people are more susceptible to developing conditions such as high blood pressure, sickle cell disease, diabetes, heart disease, stroke, some cancers, fibroids, and even lactose deficiency or lactose intolerance. When it comes to the question of what causes these factors, well, it could be a variety of things. So let's work with blood pressure for an example. It used to be thought that blood pressure was always high, or hypertension was something predominantly seen in the Black population because of our diet, because of us eating foods with high salt content, right? But studies have been done and conducted. Research has actually shown that that is not the primary cause of why the Black community has high blood pressure or greater predominance of blood pressure. They also try to look at different aspects. Could it be a genetic correlation? They've done studies as well, and they were not able to prove that the blood pressure was more dominant in like through genetics, through family, the passing down the bloodline.
Mm-hmm.
So the last factor that they were exploring and are kind of still exploring is environmental. Is it possible that maybe our life's experiences, what we go through as a Black community, where we often live as members of the Black community, could these be the reasons why we have a prevalence of certain illnesses in our community? So I can't give a real strong answer for that because research is still taking place. But what I can say is there are a lot of illnesses that happen with our community, and they don't always have the answers as to what the cause is or why. It just so happens to be. For lack of a better word, it just so happens to be. And so with that said, what's very important is for us to make sure that we are regularly going and getting checked. Because if there is something that is more predominant to us, then we have to make sure that we're doing our due diligence to make sure we're not affected by these things.
Okay, thank you so much. That is so. I didn't know about like the many different illnesses that Black people are particularly susceptible to. So thank you.
You're welcome.
My next question is, is there an affiliated cost to seeing a family doctor? And are there clinical costs that having a family doctor removes as opposed to going to like a walk-in clinic?
Okay, so there are no, I can't say there are no costs. Here in Ontario, we have something known as OHIP, which the citizens of Toronto can apply for and receive freely. And this gives us access to basic health care without any additional costs. However, costs do come into play when we are trying to acquire services that are required outside of the scope of OHIP. So for example, if you went to the laboratory or your doctor and said you want to test your vitamin D levels in your blood, that's something that OHIP does not cover and you have to pay for. Things such as TB testing that is required for employment, that is not covered by OHIP. That would require a cost. Receiving doctor's notes, that is also something that would require a cost. So for basic access to healthcare and the basic needs, doing physical checkups and things of that nature, there is no additional cost. It's only when you go towards things that are outside of the scope of what OHIP provides.
Okay. So, are there clinical costs that having a family doctor removes as opposed to going to a walk-in clinic?
Okay, so as far as I know, there are no additional costs that you would incur by going to a walk-in clinic that you wouldn't incur if you have a family doctor. The services that they offer and that are covered by OHIP are standard across the board. But I do believe that the list of price services is also standard. Mm-hmm. So they would have access to that from office. One thing you might find though is the prices may vary if from office to office. That is one thing I've noticed. Sometimes going to one particular clinic, a certain test might be $50, whereas going to another clinic, it might be $75. So those are costs that can vary. Another thing that I've also noticed is sometimes if you have a family doctor, and I'm speaking from experience, if you have a family doctor, you've built a good rapport, sometimes these doctors will even waive certain fees for you. So even though they are required to take a fee because OHIP doesn't cover or compensate for that service, depending on your relationship with the doctor, a family doctor can say, you know what, Mary, we have a good relationship, don't worry about paying for this test or paying for this. But that's completely up to their discretion. It's not guaranteed. Mm-hmm. But yeah, I just wanted to mention that.
That would be very helpful. So moving on to the next question. So what extent does having a family doctor um, differ from a physician in a walk-in clinic?
Okay, so I would say that the knowledge base is vastly different as both physicians are required to go to medical school and pass the required board exams for licensure here in Ontario. But you can build a good rapport with your family doctor, as I was mentioning before. And the experience can be better when there is greater familiarity between the physician and the patient. They know their history, they can make better comparisons based on tests you've done before in the past, and if they've been following you long term. I've had my family doctor since I was a little girl, since I was born, and that made me extremely comfortable to go and speak to that family doctor about anything. Whereas walk-in clinic appointments most times felt a little bit impersonal. The doctor doesn't really know me. They don't have any history with me. There's no real rapport. So I would say that's the difference. Not knowledge based, because they're still both very smart, very qualified, but it's the experience, I believe, that can be different.
Okay, thank you. And are there services, just building upon that, are there services that only a family doctor can provide, or why a walk-in clinic cannot?
This is a very, very good question. So, when it comes to certain services, what I would say is, if sometimes, like if you're going to say get a document signed because you need some type of disability, or work benefits because of an injury at work, sometimes I find that walk-in clinics will direct patients to go to their family doctor, just because of the familiarity and just knowing, like for me to walk into a walk-in clinic and say, hey, I have a disability, I need you to sign these papers, is a lot more challenging than someone who already knows me and knows that I have a disability. So I would say, yes, there are some things that it would be best to have a family doctor for that a walk-in clinic probably couldn't really provide or speak to.
Okay. And then just a little bit still following on the same question. Can a walk-in physician be a family doctor?
Yes. Yes, because when I was working as a physician's assistant, the doctor that I was working alongside, he was both. He was a family physician who was seeing walk-in patients. So yes, definitely.
Okay, thank you. That always confuses me. I'm just speaking from my own experience. Sometimes, like, walk-in family, why do I need both?
Oh, yes. I mean, sometimes you can go to a walk-in and you'll meet the physician, and sometimes they're even accepting new patients, and you can become their patient from a walk. So, yeah.
Thank you. Thank you. Thank you so much. For newcomers in Canada, securing a family doctor can be really difficult. What advice do you have from a physician's perspective?
Okay. So, yes, this is true. Finding a family doctor can be difficult, and not even only for newcomers. I know a lot of people who are born here, who have been citizens of the country, and even they too are having a hard, challenging time finding a family doctor because, number one, you want a family doctor that is good, and you want a family doctor that is easily accessible as well. And so, what a lot of people are finding is because there are so many people and so little doctors available, some doctors are not taking new patients because their load is already full.
Mm-hmm.
So yes, it can be challenging, but I would say don't stop. I think that would be my encouragement to a newcomer is don't stop searching until they find a physician that they can trust. If they do not, if a newcomer comes and they do not have an OHIP card, yes, there's going to be fees associated with the visits and with the services that are provided. And usually, newcomers have other areas in their life that they need to overcome and to deal with other challenges, financial barriers, right? So having to go to a family doctor where you have to pay for the services can be tough. But the encouragement is as soon as possible, try their best to see how they can access an OHIP card.
Mm-hmm.
And then from there, find a doctor they can trust. Don't stop. You will find one. It might not be quick, it might not be right in your vicinity, but you will find one if you keep searching.
Okay, thank you so much, Dr. Natalie. And then my next question is, apart from clinical service, how else does a family doctor support a patient? And the follow-up question to that is, what services can a family doctor make easier to obtain?
Okay. So apart from regular clinical services, doctors can fill out forms that are required for claims, like we were mentioning before, for WSIB, injuries, leave of absence from work, things of that nature. If someone needs access to wheelchair services, or they can assist with forms that ODSP and other services need for like dietary support, housing support. So doctors do have other things that they can do to support patients that are not just limited to clinical practice.
Yeah.
And they can also be used to sign non-health related documents. I remember before, I don't think it's necessary now, but way back, doctors used to be able to sign your passport to confirm that you are who you say you are. And doctors can also provide counseling as well. So having a family doctor makes these services easier to obtain, like I mentioned before, because you already have a rapport with this doctor. The doctor knows your history, they know your medical history, they know your experiences. And so when you have to speak to a doctor about an injury you received on the job, they can take it seriously and say, you know what, I know this client, I know he's not just trying to make something up. Like it's easier for the doctor to be in your corner if you have a rapport with them,
for sure.
right?
Yeah.
So that's what I would say. Yeah.
Thank you. Wow, I did not know about that.
Oh wow! I'm so glad that I'm providing some insights. That's good.
Thank you. Greatly appreciated. And then my next question is, understanding medical language can be difficult. How can patients, particularly Black patients, navigate this space? And a follow-up question to that is, what does advocating for yourself at a clinic look like, and why is it important?
Okay, so medical terminology is no simple thing to comprehend. We spent our entire years of medical school learning the terminology, their meanings. So it is expected that our patients may not always understand these things easily. But as a physician, it is our responsibility to break down this information in a way that is easy to understand. I know doctors who even draw or add an illustration to what they're explaining so that their patients completely comprehend what's going on. But I have also noticed that a lot of members, especially from our Black community, um, and those that may not be first generation Canadians, I find that they often have a difficult time comprehending what the doctor is expressing to them, and also have issues relaying this information to their family members. So it is not even just them not understanding, but they're not able to accurately pass the information on so that they can receive the support that they need from family. Um, I say the best way to navigate this is to ask the doctor to break it down. Ask the doctor for clarity. Don't be ashamed because you don't understand something. Make sure you, before you leave the doctor's office, you leave with a full understanding of what is going on. And if you have to, ask for pamphlets. Ask for anything that would make it more clear.
Yeah.
Or if that's still not an option, maybe ask someone to come to your appointments with you that might be able to understand better so that they can explain to you, okay, this is what the doctor said, this is what's going on, right?
Okay.
To answer your just the second part of your question about advocating, yes, advocating for yourself is extremely, it's actually the most important thing that you can do when it comes to your health. And what does this look like? It looks like asking questions, gaining clarity, even if your doctor looks unknown, even if you're asking for a certain specialized test, you're asking the question. So, what can be done? Where do we go from here? How can I access this? Just keep asking the questions, and that's how you advocate for yourself.
Okay. Thank you. Thank you so much.
You're
Um,
welcome.
our next question is, um, what should you do if you feel like your doctor's mannerisms or the way they speak to you is disrespectful? Um,
Okay, so, and it's so sad, but a lot of people have had this experience in real life where they speak with physicians and they leave feeling disrespected, and like the doctor spoke to them in a condescending way. And if I'm being honest, many doctors do not deal with criticism very well. They'll often become very defensive if you try to address their mannerisms. But it does not hurt to make sure that to let the doctor know and make sure the doctor is aware of how they're making you feel. So I would say calmly, respectfully, let the doctor know how you feel. Watch the response that you receive from the doctor. If it's one that is filled with humility and compassion, then you can continue to build a relationship there. But if it's one that is not filled with humility and is defensive and it lacks compassion, then at that point it's probably a good time to find a new physician.
okay. Okay. And so, Black people face a number of competing priorities, from employment to housing to food security, all of which make health a less of a priority. Like compared to like I need to find a job, so my health can like take a back seat.
Yes.
Are there ways in which having a family doctor can be beneficial to such individuals?
Yes. Having a family doctor is always beneficial. Although I understand that the child of life sometimes causes us to put our health on the back burner, especially when we feel as though we are okay and there's no visible signs or symptoms that we are ill. It's easy for us to say, you know what, I can book that appointment next time. Let me just keep pushing it back. But Seeing a family doctor is beneficial as sometimes the professional input is required by a family doctor to even access some of the services within those other industries, housing, food, right? Securing finances. So it is definitely important to have a family doctor. Working at the clinic myself, I've come across patients that required signed documents to support their housing requests, to fulfill immunization records that are required for employment, and also to obtain dietary allowances for special conditions, right? But it's also important because it's good for a doctor to help guide you with dietary restrictions that may need to be followed closely if you are experiencing illness, right? So that's what I would say to that. It's very, very important to have a family doctor even when you have other things going on.
Hmm. Wow. I honestly didn't know any of this. Like I'm just
Yeah.
right now. I swear this is new. I didn't know that. I'm so used to like the traditional way of thinking. I guess like go to the doctor if you're ill. Not
Yes,
everything
yes.
for doing that.
No, it's imperative. It's very important.
Thank you.
You're welcome.
If a patient is struggling to find a family doctor, are nurse practitioners a good alternative? And that's the first component. And the second component, how can we make seeing a family doctor more routine within the Black community?
Okay, so nurse practitioners are a great alternative to a family doctors. They do have the ability to prescribe medications and treatments for conditions, and they have the ability to even order tests and studies. And they, as far as I know, they are able to open their own clinic as well. So I do think that nurse practitioners are a great alternative to a family doctor. In the event that you can't find one, then a nurse practitioner would be the next best bet. And how can we make seeing a family doctor more routine? Well, one day we can make it more routine is to maybe try to increase awareness or provide educational seminars that can highlight the conditions that are more prevalent in our community. Also, to place a sense of value on the necessity of seeing a family doctor. For example, there's routine screenings should be done at certain age points to help catch a disease early or help to cure or create a better outcome with treatment. So I think if we allow the community to know these things, then it hopefully should encourage them to come out and have a doctor.
Okay, thank you.
Yeah.
We are pushing the end of the podcast, but with regards to self advocacy within the clinical environment, what rights does the patient have when interacting with a family doctor and within a clinical environment?
Okay. So patients have the right to be heard. Patients have the right to express their concerns and their fears. Although I have seen in practice where patients advocate for different treatment and preventions, they will advocate for different diagnostic studies. But one thing the patient must also keep in mind is that physicians will not order something or an intervention that they feel like is not necessary or beneficial. And I'll give you an example of this. Like a patient comes into the clinic with a cough, and they feel like it's bacteria related. So the doctor recognizes that this is not something that is bacteria related. It's most likely viral. But the patient begins to ask for antibiotics. Give me antibiotics. I want antibiotics. Because the last time he had a cough, antibiotics probably resolved that situation. So the doctor's not going to prescribe antibiotics, one, because he knows it's not going to address the situation, and two, it will probably create a more negative outcome in the long run by creating antibacterial resistance,
Yeah.
right? So yes, it is important to advocate for yourself, and you do have a right to express your concerns and your fears. But at the same time, has the doctor is not going to just bend at your command,
Mm-hmm.
right? Although I say this, I would never want someone that may be listening to
Yeah.
think that once a doctor says no, that's just the final say. So I don't
Mm-hmm.
want to give the wrong impression. It is not a bad idea to get more than one opinion
Okay.
for what you might be experiencing. So if you feel strongly that after advocating for yourself that you are not comfortable with the information you're receiving, then it's okay to seek for help or advice from another doctor,
Okay.
right?
Okay.
Okay.
Thank you. And then
You're welcome.
my last question is, what what do you do if you don't feel comfortable talking to your family doctor about certain health issues?
So honestly, if you do not feel comfortable speaking with your family doctor, or there is not a platform for you to be transparent, my advice would be to definitely seek out a new physician, one that you can be comfortable and open with. Because receiving optimal healthcare is
Mm,
actually dependent on the information that you share about yourself. And sometimes holding back information or failing to provide information about yourself can be the cause of a physician missing or a specific diagnosis. So if you're not comfortable, my advice is try to find another doctor that you feel more comfortable with. One that you can be completely honest and transparent with, because they're going to need your honesty in order to help you most effectively.
okay. Thank you so much, Dr. Natalie. That this concludes our podcast for today. Thank you so much.
You're welcome. Thanks for having me, Mary.